Welcome to Independence Nation on the Light of Life Network. Today we're going to talk about this situation that's going on with the VA and the Secretary of Veteran Affairs, who goes by the name of Eric Shinseki, and that many think that he needs to be removed. There's been several problems going on with the VA and VA hospitals where our veterans are dying from malpractice, and also the backlog of basic paperwork that these veterans need to be taken care of, those from Afghanistan, etc., who were wounded and haven't been taken care of, and that Shinseki should have done something over this situation. Subsequently, President Barack Obama should have replaced Eric Shinseki with another Secretary of Veteran Affairs. But we're going to take a look at it and its entirety today. This article reads, "Wrongful death suits have cost Veterans Affairs over $200 million since 9/11. That's $200 million, and most of those are from malpractice suits. But let me read a few of the excerpts of the article. The U.S. Department of Veteran Affairs has paid more than $200 million in wrongful death payments to military families who needlessly lost their loved ones in the years since 9/11, according to a new report from the Center for Investigative Reporting, also called the CIR. Now, it shows, as I said, there's negligence. It says here, negligence, wrongfully denying mental health treatment, failure to disclose relevant health information to the public, and other serious infractions are among the issues that have cost veterans their lives. And yes, my dad is a veteran. This is the reason why I was drawn to this issue. If my dad would have lost his life over these simple malpractice and simple paperwork issues, I would be irate also. I can't blame their families for the way they feel concerning our government right now and how our veterans have been treated. But let me read further. The issue has become serious enough to warrant a hearing with the House Committee on Veterans Affairs, which will investigate preventable deaths, and a hearing scheduled for April the 9th. Of course, this is past April the 9th. This article is from a previous date. Now, the same committee held a hearing on the matter last year when they wondered why, after a Legionnaire's disease outbreak at a Pittsburgh hospital killed 6 veterans and left 21 others ill, the VA regional director, after this incident, was given a $63,000 bonus. That's according to the CIR. So our veterans are dying, and he's getting a bonus for it, $63,000 for doing nothing. Okay, so let me read further. It's not enough for VA to simply compensate the families of those who died, said Representative Jeff Miller, and he's of Republican of Florida. In order to provide real closure for those struck by these heartbreaking preventable deaths, VA needs to hold fully accountable the employees who allowed patients to slip through their cracks. Now, just to give you a little view of how our veterans are coming in, you can see here depicted in the picture, he's injured, that they're wanting to have their issues resolved, but the paperwork and the backlog, and they've been stifled for years on getting their issue resolved. Now, it says further here, Secretary of Veteran Affairs Eric Shinseki responded to that assertion, meaning he responded to those saying that there needs to be more accountability and that they allowed the patients to slip through the cracks. So Eric Shinseki responded to that assertion, and I guess he's saying that 6,000 VA employees were involuntarily removed from their jobs over the past 2 years. Now, if 6,000 have been removed. We just need one more, and that is basically you, Eric Shinseki. You need to be removed, and we need better representation for the VA. Now, still, according to the independent legal experts who spoke to CIR, that 1,000 lawsuits are only a fraction of the veterans who have lost their lives because of malpractice. When those families try to file suit, however, they must endure a long administrative process that can drag on for months or years, only to end with no financial damages awarded to the family. In other words, the government's not going to take initiative for what's been done, and they're not going to compensate. Thank you for fighting for us. Thank you for fighting Vietnam, etc., Afghanistan. Thank you for losing your limbs. Thank you for putting your life on the line, but we're not going to do anything for you, as is said here, for months and for years, only to end with no financial damages awarded to the family at all. And that's not just for those who put their lives on the line, but those who lost their lives in malpractice. Now, the VA announced it had sliced its backlog, and of course, as I said, the backlog is part of the problem. The VA announced that it had sliced its backlog of medical claims by 44% since March of 2013, cutting the number of processing claims delayed for more than 125 days from 611,000 to 344,000. And though that is good, it's just not enough. The number of claims has skyrocketed under U.S. President Obama after the administration enacted new rules which permit more Agent Orange claims and loosen restrictions for veterans who return from Iraq or Afghanistan. And those Agent Orange claims should have already been taken in, and they've basically done nothing, and they get rewarded while our families, our veterans, are passing away. This is Keith Pitts reporting for Independence Nation. I'll see you next time.